The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Today on Aging Horizons, we'll be speaking with Janet Stellman. She's the SHIP director for Montana. She'll be telling us what is SHIP, what does that mean, and who are these people that can help you. She'll also be going over Medicare. What is it? What are the different parts? And where do you go if you have questions, both about your benefits and how to pay for them? So make sure you stay tuned to today on Aging Horizons.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
This is Bill. He just received his new Medicare card and is following some simple rules to protect himself from fraud. He knows to never give out his Medicare, Social Security, or bank number over the phone. And this is Nancy. She knows that to detect any problems, she always reads her Medicare Summary Notice or Medicare Advantage EOB to make sure the billing is correct. Both Bill and Nancy know that anything suspicious can be reported to Montana SMP at 1-800-551-3191.
45 years, 2 packs a day. It's like $80,000. I thought I was just hurting myself until I fell asleep in a chair with a cigarette. The whole house went up. I lost it all. I knew smoking was expensive, but I never thought it would cost me everything.
The human heart. Even at its strongest, it's a fragile muscle. Chest and arm pain, shortness of breath, are signs of a heart under attack. But 3 numbers can save a life. Dial 911 at the first sign of a heart attack. Quick response from medical experts can save your life.
I was 45 and it happened to me, a heart attack.
Dialing 911 saved Ryan's life. Now he's here and he's healthy.
This message sponsored by Mission Lifeline Montana.
Welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services. I'm Katie Lovell, and I'll be your host today. Today's guest is Janet Stellman. She is the SHIP director for the Montana Department of Public Health and Human Services. Janet, thank you for being here today.
Thanks for having me.
So I assume that because you're the SHIP director, that means you are a cruise director, something like that, correct?
Sounds like it, right?
Yeah.
No, SHIP stands for the State Health Insurance Assistance Program. We are funded by ACL, or the Administration on Community Living. We are just a network of folks that are unbiased and free, confidential, to help Medicare beneficiaries through the maze of Medicare. So we have them located all over the state. They can just call our number and they'll get in touch with a local SHIP counselor.
And what does a SHIP counselor do? When I go to visit one, what should I expect?
Well, they'll ask you what your Medicare coverage is right now, or what your insurance situation is. If you're new to Medicare, they can help you enroll. They can help you with every year. October 15th through December 7th is our open enrollment period, which means people have the chance to sign up for a new drug plan. That's our busy year, so October 15th through December 7th, and the SHIP counselors will help them do a personalized search on their medications and guide them to what might be the best plan for them for the next year. So
SHIP counselors help with Medicare.
Right.
Let's talk about Medicare in general. What is Medicare?
Well, Medicare is confusing to a lot of people.
Sure.
Medicare is a federal program that gives health insurance coverage to people that are 65 and older, or people who have been disabled on Social Security disability for 2 years. There's also folks with end-stage renal disease and Lou Gehrig's disease who can also access Medicare before the age of 65 too. So.
And I believe I know this right, but Medicare has all sorts of letters, A, B,
Right, there's
C.
all kinds of alphabet soup with Medicare. Medicare Part A is the hospital coverage. Most people get it premium free, so they have enough work quarters, or their spouse does, to get premium free Part A. Otherwise, it's $400 and some a month for Part A. Part A covers the hospital services, so inpatient type services. Medicare Part B is it is roughly right around $170 a month this year. It covers doctor services and DME and stuff like that. I'm going to skip over C for a minute. Medicare Part D is the drug benefit, the prescription drug benefit that started in, I think it was like 2006. It came out of the Bush administration, out of the Medicare Modernization Act. And it was the first time since 1965, when Medicare was created, that a drug benefit was available to Medicare beneficiaries.
Wow.
So that's amazing. Part C is it is the Medicare Advantage plans. So Medicare gives these companies, these private companies, a pot of money and says, okay, you administer their Medicare benefits. It has to cover everything traditional Medicare covers, but sometimes it covers a little bit extra, and it might cover it a little bit different.
Okay. So when a person is looking at Medicare, or as compared to traditional insurance, most people will have an A, a B, and D, or a C, correct?
Right, that's correct.
So you wouldn't have all four, probably.
No, you cannot have traditional Medicare and a Medicare Advantage plan at the same time. So, because it doesn't make sense. So.
And I've heard of Medicaid, and I know a lot of people get confused when people say Medicare or Medicaid. What's the difference between the two programs?
Well, Medicaid is it's also a federal program, but it's state run. So it's for lower income people, people that have lower income and lower resources. So Medicare, traditional or regular Medicare, isn't income based. So it's just eligibility based, whether you're 65 and older or you qualify for it for a disability. So
sure. And how do folks know that they qualify for Medicare?
Well, usually when you're getting close to your 65th birthday, it's a good time to look into it, because you have what's called your enrollment period, and that's 3 months before your 65th birthday, the month of, and 3 months after. So that's your initial enrollment period to get into it, and that's the best time to get into Medicare when when you're first eligible for. I mean, there's things to consider. Are you still working? Do you have employer insurance? Does your spouse have employer insurance? Because sometimes you can delay taking your Part B, the one that has the $170 premium.
Okay.
So.
And then how do you know if you've worked enough the work quarters,
right,
the work credits?
Well, the enrollment arm of Medicare, you would think it would be Medicare, but it's actually Social Security.
Okay.
So Social Security knows that. And you can apply at their website at socialsecurity.gov, and they'll let you know if you have enough work quarters and for how much your premium is going to be, and what your premium is going to be. So
if you have questions approaching your 65th birthday, where do people go?
Call your SHIP counselor, and it'll be on the screen. And they're a great wealth of information. They know Medicare, so.
And when I call a SHIP counselor, and am I going to be talking to someone in California or New Jersey?
Nope, they're all Montana, and that number should direct you to based on where you're calling from, should direct you to your local SHIP counselor.
So you'll be talking to someone in your area?
Right.
Wonderful. Well, when we come back, I want to talk a little bit about original Medicare and the Medicare Advantage plans and those plan finders to help people determine how they get into one of those plans. So make sure you stay tuned. We've already covered a little bit about what Medicare does, what the different parts are. And when we come back, we're going to talk a little bit about those Medicare plan finders and how you figure out which Advantage plan or combination of A, B, and D is best for you. So make sure you stay tuned.
I've been shooting since I was young.
It's something I've always enjoyed. I wasn't feeling like myself when my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
Respite. It's okay to need it. It's okay to want it. Will you provide it?
The hard part about having outside help is that there's not a lot of people out there who can do that kind of work. We've been very fortunate that our Bonnie has been with us for 7 years. I don't know what I'd do without her. I need her in our lives. She's our second mother. And I can't help but think of her that way.
To find out how to change lives, including your own, call 800-224-6034 or visit respite.mt.gov.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare Savings programs, call your local SHIP counselor today.
Maybe I better text him.
Summer in Montana is a great time to visit your local farmer's market. Enjoy the social atmosphere while shopping for a wide variety of fresh, locally grown produce. Together with both WIC and Senior Farmers Market nutrition programs, you help feed your family 5 or more daily servings of fruits and vegetables for better health. You also help local ag producers and enhance the state's economy. So, for summer fun that's nutritious and helps Montana's economy, shop at your local farmer's market.
Welcome back to Aging Horizons. Today we're speaking with Janet Stellman. She's the SHIP director for the state of Montana, and we are going over all things Medicare. So we just went through the Medicare parts A, B, and D, and also C.
Right.
And so is there one option for folks? Is it just you get this A, this B, this D, or this C, or are there other options?
No, when you come in to look at Medicare, you get to choose how you take your Medicare. Again, there's the traditional model of Medicare, which is you have Part A, Part B, and a drug plan. May have a drug plan, depending if you have other creditable coverage. With traditional Medicare, it's an 80-20 split, so Medicare pays 80% and the beneficiary pays 20% after deductibles and code, and then they're responsible for the 20%. Also with traditional Medicare, you can go to any doctor that accepts Medicare.
Okay.
So if they take Medicare, you can go to them. Another thing you can do with traditional Medicare is you can pick up what's called a Medicare supplement or a Medigap. And these are individualized plans from insurance companies that just help you pay your 20%.
Okay.
Okay. So those could be very basic to, pretty much covers a whole bunch of stuff. But, of course, the premium for those are going to depend on which one you take. So,
sure, absolutely.
And they can be really good, and you can look at Medicare supplements or Medigaps on the CSI websites, Commissioners of Insurance, at csimt.gov.
Okay.
And there's a Medicare section, and it talks about what Medicare supplements are and Medigaps, and it also kind of they do a survey every year, and it gives you an idea of what it would cost you for each plan at what age you are. So
okay.
So if that's not the route somebody wants to go, there's also the Medicare Advantage or Medicare Health Plans or Medicare Part C.
Okay.
And again, I talked about how the government gives these plans like Humana or United Healthcare or I can't think of any right now, other ones, but there's several of them, and gives them a pot of money and says, okay, you take care of their Medicare benefits each year, because I guess these companies have said they've told Medicare that they can handle this cheaper than what traditional Medicare can.
Sure.
So Medicare says, okay. And so it has to cover everything traditional Medicare covers. Sometimes it covers extra stuff like silver sneakers or a gym membership. Sometimes it covers, it might have some dental or hearing or vision.
Sure.
And instead of paying 80-20 split, it's usually every time you go to a doctor, your doctor, it's going to cost you $10 or $20 co-payment.
Sure.
One thing about Medicare Advantage plans, most of them have networks, so you either have to go to somebody, a provider in the network, or you're going to have to pay more than.
Sure, you're going to have to pay that out-of-network cost.
Right.
Yeah.
One thing about Medicare Advantage plans is they have maximum out of pocket. So once you hit a certain amount, like 4,000 to 6,000, some of them are 8, some of them are 10, maximum out of pocket. So that's what you're paying for the whole year.
Sure.
Whereas traditional Medicare, you're going to pay that 80-20, 80%, 20% the whole way through the year.
Okay, so no matter how much your medical bills are that year.
Right. Whereas, and then Medicare Advantage plans have the, that maximum out of pocket. So that could be nice for people too. It just depends. Medicare Advantages aren't in every county in the state.
Sure.
And that has to do with network issues and whether they can find providers that want to be in their network. There also is a special Medicare Advantage. It's called a DSNP. And what that is it's a special needs program, and it's for people that are on Medicare and Medicaid.
Okay.
And it provides a little bit more case management, kind of managing, helping the person manage. It also has grocery card. It also has a over-the-counter benefit from the Humana online pharmacy and stuff.
For things like Tylenol.
Yep.
Oh, yeah, okay.
And so it is really could be a good program for those people that are on Medicare and Medicaid or QMB eligible folks. So that's a special plan, but SHIP counselors can tell you all about those. So
okay, and what is the plan finder? What does that mean?
Okay, so the plan finder is on Medicare.gov.
Okay.
You can go on yourself if you feel comfortable getting on the computer, and you can create an account at Medicare.gov, and it will bring up a list of your prescriptions that you've got over the last year. So you can go to the plan finder, and it says on Medicare.gov, it says find health and drug plans. You click on that, and it's going to ask you a few questions. If you've logged in with your personal information, it'll pull up that stuff, so you don't have to answer some of those questions.
Sure.
But you can also just do a generic search too and not sign in and do it. But what it's going to do is it's going to ask you for what your drugs are, what the dosage is, how often you get it, what your favorite pharmacy is, and then at the end, it will categorize them by the lowest estimated annual cost for a drug plan. Or you can also look at Medicare Advantage plans on there too. So, and it'll let you compare these plans on which one looks like the right one for you.
Because it's certainly not a one-size-fits-all sort of situation.
Right, because what may be good for your husband may not be good for the wife.
Sure. Absolutely. Probably depends on the drugs you see and the doctors that you want to visit.
Exactly. Well, exactly. And so that's real important to do an individual search.
Well, awesome. Thank you. I didn't know about some of those different types of all of the Advantage plans. That's really interesting. When we come back, I want to talk a little bit about the folks that are having problems paying for their Medicare and what programs might be out there.
That's my favorite to talk about.
Wonderful. So make sure you stay tuned. We're going to cover some of those helping programs that'll help you cover your Medicare costs. So stay tuned.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
I was the last guy you'd expect to get diabetes. I was a competitive runner and I always took care of myself. So when I was diagnosed, it kind of threw me. But it's really encouraging to know I'm not alone with it. There are a lot of other people going through the same things as I am. It takes some effort. You have to keep after it. Exercise, meds, and diet are the key. But there are a lot of folks who want me to succeed. Diabetes is not the end of the world. With effort and attitude, you can have a normal life.
Like many areas in Montana, Helena is nearly surrounded by forest and is at risk of a devastating urban fire. Wind-blown embers from wildfires have ravaged communities like Denton, Montana and Boulder, Colorado. Now is the time to prepare your home for wildland fire, no matter where you live. Be aware and prepare. Make you and your community a safer place. Visit firesafemt.org, paid for by FireSafe Helena and aired by the Montana Broadcasters Association.
Welcome back to Aging Horizons. We're speaking with Janet Stellman, who's the SHIP director for Montana. We're talking all about Medicare. So, Janet, I know that Medicare is a really great deal for folks, but there are still folks that are struggling, especially in this economy, to try to make those monthly payments. What help is out there for folks?
Oh, there's a couple different programs that I love talking about them. I could talk about them all day. One thing when we go through SHIP training and the counselors get trained, one of the things I always encourage them to do is anytime you have somebody on the phone or in your office that you look to see, screen them if they're eligible for these programs because they're so helpful. The first one we're going to talk about is the Medicare Savings Program. So you may have heard about QIMBY, SLIMBY, or QI.
Sure.
Okay, so there are three different levels of assistance, and what they mainly do is help pay that $170 a month premium for Medicare Part B.
Okay.
So imagine getting $170 back on your check every month.
Wonderful.
Awesome.
Yeah.
So SHIP counselors can help people apply for that. It's a real quick application. It's administered through the Medicaid office or the Office of Public Assistance around the state, but SHIP counselors can help from wherever you're at. We can help you. It's also, if you qualify, if you have the lowest income and resources, the QMB program also acts like a supplement to Medicare.
Oh, wow.
So it not only does it pay the Medicare premium of $170 a month, but it also pays that 20%.
Oh,
where it's an
wow,
80-20.
that's a huge help for
yes.
folks.
And also if somebody's on a Medicare Advantage plan, it'll help pay with those co-payments too. So the other two programs just strictly pay the premium. So
okay.
The other program that is, it is really awesome, is the Low Income Subsidy or Extra Help Program. You apply for that at socialsecurity.gov, or a SHIP counselor can help you apply for that. It's a real quick application, and what it covers is it helps pay your Part D or your drug benefit costs. So we know that drugs can be very expensive, and if you qualify for this program, you can have drug or co-payments anywhere from $1.45 up to $9 per prescription.
That's much better.
Yes.
I assume would be.
There's two different levels. There's a full subsidy and a partial subsidy. So those people on a partial subsidy, they may have to pay 15% of their cost, but it's still better than having to pay 100% of their cost. So.
And can someone have the Medicare Savings Program and the Low Income Subsidy?
Yes, in fact, when you when we help people apply for Low Income Subsidy on that online application, there's a specific box that says we're going to send your information to the local Medicaid office to have them look at Medicare Savings Program. If you didn't want that to happen, you would check the box. So unless you actually check that box and don't want your information sent to the Medicaid office, it's going to get sent. So they're going to look at the Medicare Savings Programs for you too.
That's wonderful. That would be a huge help for folks that need both help with that Part B and D. That's a huge problem.
And they say the Medicare Savings Program average is about a $2,000 savings per year for people.
Wow.
But then again, if you get on the QMB program, that savings is going to be is going to be more because it's going to help pay that 20% that Medicare doesn't pay. The average savings for the low-income subsidy or extra help, they say, is $5,000 per year.
Wow.
But we know that's low too, because you get some of these higher prescriptions and that maybe cost $900 a month.
Sure.
That people that qualify for this extra help program are paying $9.30 or $5 for it, you know.
And it probably allows them to take more medications than they would otherwise be able to.
Right, because if you can't afford your medications, you're going to not take all of them.
Absolutely.
So, love those programs, and we really like to see people get on those. The third one I want to talk about real quick is the Big Skyrx Program. It is a program that started during the Schweitzer administration here in Montana, and it is called Big Skyrx.
Okay.
It's funded by tobacco tax. So, and it's for people that, you know, really kind of fall through the cracks. Maybe they make a little bit too much income, or they have too many resources, things they own. Well, with Big Skyrx, they have a higher income limit, and they don't look at resources. So,
wonderful.
And that program, what that provides is it just pays up to $35 or 36 something of a Part D prescription drug plan, or a Medicare Advantage plan drug portion of it. So. And it can pay the company directly, or it can deposit it right in your account. So
that's wonderful. Just gives you a little bit of extra money back each month for groceries or gas
right.
or whatever.
It's not much, but it's a little something. So.
Absolutely. So folks should apply for these. There's probably higher income resources limits than people think, and it's always a good idea, right?
Right. It doesn't hurt to, you know, apply or be screened. Call your SHIP counselor. We can help you with that.
And it sounded like a lot of different applications, but really the SHIP counselor can really help you work through those.
Right, yep.
Wonderful.
So,
and if folks are struggling, you know, maybe they have a really high priced drug, they're really concerned about what to do, that open enrollment time is really the time to look at that, correct?
Right. With open enrollment, whatever drug plan or Medicare Advantage plan you're on this year may not be the best plan for you next year, because the companies could change their formulary. They could, you know, like drop drugs. They can increase the price of drugs. So it's very important to check every open enrollment period, which is October 15th through December 7th, to see if your plan still is the best plan for you, or if there isn't a better plan for you to get into for the next year. So,
great. So moral of the story is really get to know your SHIP counselor.
Right.
Get them on the phone.
Yep.
All right. Well, thank you so much for sticking with us today. We went through Medicare, the A, B, the D, and the C of Medicare, what they cover, and how to get assistance with covering those costs if you need it. So make sure that you reach out to your SHIP counselor every year to go through those plans, to find a new one for you, to find what's best working for you, and make sure you call your SHIP counselor. Thank you for staying tuned with us to Aging Horizons.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.